Request Mr. Yogesh to please play a video.
This is basically a video on antimicrobial resistance. This is the first time we are showing this specifically made for antimicrobial resistance.
Antimicrobial resistance, a samurai style. I was not born with a name. People simply call me an antibiotic. I was forged to cut down infection, to strike at the invaders that creep into blood and lung and bone. Pneumonia, bloodstream infections, that refuse to heal. I face them all with one purpose: to give my patient one more sunrise. Something changed. They began to summon me when I was not needed. For simple colds and flu I could never cut down. They took me in, half measures, and left me the moment they felt better. Every unfinished course was a battle I was forced to abandon. Every careless dose, another crack in my steel. Enemies that once fell at a single stroke began to stand their ground. They hardened their armor, multiplied in the shadows, and learned to ignore my blade. Now, in some fights, I strike with all the strength I have left, and the enemy does not fall. I have stood at this doorway for generations, holding the line between life and the darkness beyond. I ask only this: call for me when I am truly needed. Let me finish the work I am given. Do not send me to fight the wrong enemy. Do not use me for colds and simple flu, for viruses I cannot touch. Guard my strength, and I will continue to guard your future. Use me wisely, and I will stand here still, for you, for your children, and for every sunrise yet to come.
Very educated video. Thank you, Nasaini.
And he will tell us about this program. Dr. Narendra Saini.
You know, AMR is a big issue. 10 million people are going to die in 2050 if this trend continues. So, globally, everybody is talking about, now previously there used to be talk about tuberculosis, there used to be talk about HIV, but today everybody is talking of antimicrobial. This is because we do not have the weapons. You just saw the video. We do not have the weapon to kill now the new organisms which are developing. So actually now I will just see what we are going to do, what as doctors, what as by community we can do, because I see so many community people are also here. What we can do. First, I go with the slogan, act now, protect our present. Act now means, as I said, we don't have the weapons. We have to preserve what we have. So this is the time when we act. Protect our present. If we act now, because we don't have any antibiotic in the horizon, new antibiotics. So by acting now, at least we can preserve the antibiotics, we can regain the sensitivity of the organisms. That is very, very important if we use rationally these antimicrobials. And infection control, which is the most important part of it if we want to protect our present. Do not allow the germs to enter in our body. Do not allow the infective germs. Germs are there. Do not allow the culprits to enter in our body. For that, infection control is important. And preserve our future. That is, we all know. Kal is khel mein, I remember that old song which was there. Kal is khel mein hum ho na ho. बाकी दुनिया हमारे बच्चे हमारे परिवार होगा. It is our moral duty to protect them. So preserve their future. So coming to now, the next thing is taken as blue. IMA has given a call 18 to 24. It's a global call which IMA is pursuing it. Go blue. Blue is a color. We have also, you can see everything is blue here also. The blue says a symbol of peace, a symbol of cooperation, a symbol of strength, and a symbol of bringing everybody together. This is the symbol of blue. And I see today, when I see my hall here, which is at IMA Hall, and I can see in front of the screen, I see various kinds of other organizations being here. I can say at least IMA has taken that lead of taking it blue, bringing everybody together. So this is blue. And then coming to the most important part, preserving tomorrow. Hand hygiene, we say, always is the first step against our fight on AMR, antimicrobial. We do not allow the germs to enter, the infective germs to enter in the body. I'm specifically saying anti-infective germs because we all have germs in our body. 80% of our body is having good germs. But unfortunately, by unjudicious use of antibiotics, we are killing those good germs and allowing the bad ones to propagate. So with that intention, we have put this theme of protecting our future by inculcating, by creating awareness on hand hygiene. So hand hygiene, when we say hand hygiene, you can do hand rub or you can do hand washing. Hand washing is so I was just talking about that this is an important thing, hand washing and hand rub. So wherever possible, we should use hand washing. But because for that clean water and soap is required. Sometimes these things are not available. Sometimes the clean water is not there, or sometimes it's difficult to go to a washroom to clean hands. We can use a hand rub. But if your hands are soiled or dirty, then hand rub will not work. So this is the message we want to give. Hand washing protects you.
Thank you, Dr. Venkatesh Saini sir, for beautifully explaining the message of AMR and the theme of AMR and what we do in AMR in such a beautiful way. Now I request our respected and dear National President, Dr. Dilip Bhanusali sir, to say a few words and guide us.
Good morning, friends. Are you able to hear me?
Yes, sir.
Yeah, good. Dr. Narendra Sani, Chairman of this AMR committee, our immediate past President, Dr. R.V. Ashokan, sir, incoming President, Dr. Nayak, Secretary at the Head Office, Dr. Saradari Datta, Dr. Piyush Jain, the Finance Secretary, all the senior past presidents, starting from Dr. Samram, to Dr. Vinay Agarwal, Dr. Jailal, Dr. Sarad Agarwal, and who has joined. My Vice Presidents, Dr. Hune Kapadia, Alex, Vidnal sir, Garg, all the presidents and secretaries of various branches from all over the country, the chairman of various committees, I see from the JDN people also. So this is Dr. Utre. I can see Dr. Utre there. Yeah, Dr. Prasad, Subhash Chandra Bose, Dr. Reshmi Mehta. Friends, I think this is a very important. कह सकते हैं ये मुहिम है, एक बड़ी मुहिम छेड़ रखी है against drug resistance AMR. This has become a worldwide phenomenon. It's not only in India. And only day before yesterday, I had put a video on the social media where the article which came in Lancet, a study which was done in 5 countries, India among them, was done at AIG Hyderabad. Dr. Nageshwar Reddy was the main author of that study, which showed that 83% of our people are resistant to antibiotics. Horrendous amount of things, 83%. We can't believe it. British has 13, USA 34. So the amount of antimicrobial resistance in India is so horrifying. And that's why this seminar is to bring awareness not only among our medical professionals, but throughout the length and breadth of our country. This should be propagated. The obnoxious use of this antibiotics, what we do. And on top of it, there are few factors which had to be highlighted here. One is about the quacks which have been doing this, using third generation antibiotics without knowing their indication and the dosage. The second important thing is we have seen, of course, the use of antibiotics has come down after we realized the importance of AMR. But earlier, every fever used to write antibiotics. And we know right now that 80 to 85% of our fevers are viral fevers, which doesn't require antibiotics. So as we have grown, we have been reducing the use of antibiotics. But unfortunately, the quacks, especially in 2-tier, 3-tier cities, have been using this. It's been widely used in the veterinary area, the fishery, the cattle. We have seen that it has become a rampant thing, which has caused a lot of. In fact, the study says that any normal person entering into a hospital has already he has a resistant to almost all the antibiotics. So where this is going to lead, we don't know. But what we can do is teach our patients, teach our colleagues, teach our citizens that antibiotics should be used very judicially. The second important point was regarding the online people getting antibiotics. Without prescription, getting antibiotics online, on the counter, these are two very important factors which have to be brought and noticed to the government. We have in fact written to the health minister. I wrote to the prime minister also regarding this. In fact, if you see the amount of online delivery of antibiotics, which has increased threefold in last 2 years, this has to be stopped totally. And in the health minister only yesterday gave a big direction and statement in the press regarding this AMR, which has come in the press right now. So IMA plays a very important role here, and I think all our president, secretaries, and all the members who are present today, let's all pledge together that we see that this AMR message has been conveyed throughout India, throughout the patients and to our colleagues. Thank you. Jai Hind, Bhai.
So next, I'll request Dr. R.V. Ashokan sir to say a few words and give his guidance.
Thank you so much. AMR, the activity done by Indian Medical Association is pioneering. I should say that the pioneer, without any doubt, is Dr. Narendra Saini and a very beautiful team under him with Venkatesh, Karthikeyan and others have been doing a wonderful work. They have taken the lead and two concepts, very unique concepts of forming a coalition, professional coalition, because antibiotics belong to modern medicine. And it is our singular duty to bring all the professional associations in modern medicine to face this issue. The second one is the AMR Smart Hospital concept, which has no parallel in the world. So these two initiatives are the original brainchild of Dr. Narendra Saini. And I am sure he will be able to carry this initiative into future as a pioneering effort of Indian Medical Association. All the best to the movement.
Thank you, Dr. R.V. sir. Now I'll request Dr. Anil Nayak, our President-elect IMA, to say a few words.
Thank you, Dr. Saini, Dr. Bhanushali, Dr. Sarvadidatta, Dr. Ashokan, and all the dignitaries who have joined this meeting, and local DMA office bearers and all the members. Just I want to, nothing to more say regarding AMR, but I congratulate Dr. Narendra Saini. As you know, people, when we
All the students, please
become
come.
president or when we become president and secretary, at time everybody asking for chairmanship of so and so committee, but nobody is working. They want to put their name as a chairman. But I congratulate Dr. Narendra Saini. He is hard working. Sometimes he is calling 10 to 15 times to all the office bearers regarding promote of the AMR. So I congratulate him regarding this. Nothing to more say regarding AMR because the expert and all they have said regarding this. But I welcome everybody and I request everybody to come to attend centenary conference NETCon 2025 at Ahmedabad Clubhouse centenary conference. So I request everybody kindly register as a delegate and please come and join to enjoy 27 and 28 December in Ahmedabad. That is my personal request to you. Thank you. Long live IMA. Jai IMA.
Thank you, sir. Now I request our HSC madam, Dr. Sarabari Datta, to guide us about this AMR program.
Sir, I welcome all the dignitaries who has joined in this meeting. And what I have to say that in today's world, there is always a rush lunch for grabbing a sandwich or a burger, and is practiced doing it is practiced during work all through the world. And before that, hand washing is always forgotten. And so it is the food is taken from the packet as such, and hand washing is always valuable for taking before taking food or before any handling of any object, and it safeguards the human against infection. So let us go for spreading the 12 steps of hand wash to everybody to create an awareness against AMR. Even if the 12 steps are not followed very, in a strict way, even a hand washing with the soap, whatever it is, before taking food will always give result. And I thank Dr. Saini for this noble initiative, and we think we will always join hand in hand to spread this thing all over the world. Thank you.
Now I request Dr. Vinay Agarwal, sir, our past president IMA and mentor to many, to please say a few words and guide us.
National President Dr. Bhanushali, dignitaries present in the IMA headquarter building, and dignitaries all around, all past presidents. See, I want to congratulate Dr. Narendra Saini. He has taken it as a mission, AMR activity. I share the same views what Dr. Anil Nayak had just said, that it is Dr. Narendra Saini who has taken this initiative. And not only initiative, is working as a missionary with a missionary zeal. He is taking it over. And I'm very, very confident that under his chairmanship, AMR committee of Indian Medical Association will do a tremendous job. And I also want to congratulate him that he has just been appointed and being a part of WHO Civil Society Task Force on AMR. This is another honor which has been bestowed on you, Dr. Saini, for your hard work in this field. And I'm really, really confident that for me, not only you are a family member, but simultaneously for Delhi also, you are a shining star, and you have really shown your mettle as a Secretary General of Indian Medical Association also. AMR is one of the very, very important activity, and I'm sure Indian Medical Association getting involved aggressively and actively in AMR will really bring fruits. And with this, once again, I congratulate you. Thank you very much.
Thank you, Dr. Vinay Agarwal, sir. Now I'll request Dr. Jayalal, sir, President Commonwealth IMA, to say a few words and guide us.
Yeah, thank you very much. And we just completing antimicrobial resistant awareness program in the medical college. There is a lot of students are involved in this. This is the end program is happening. we just also had the hand washing program also was conducted here, and this lot of awareness programs were created. It was I think the so thank you very much, Shaini, for this wonderful initiative which you are doing, which has been happening place across the country. So thanks a lot.
Thank you, sir. Now I request Dr. Sharad Agarwal, sir, past president IMA, who is present in the IMA headquarters, to say a few words and guide us.
The AMR is going to be the biggest healthcare emergency in coming few years, and it will be a global emergency, as we all know. Million time of we see as a COVID, and it is the responsibility of as a doctor and leader of doctor fraternity also that we should sensitize our colleagues, our friends, the value of a simple thing of hand hygiene, which also contribute to less infection, less intake of antibiotics. At the same time, we have to sensitize our colleague also first that what is the rational use of antibiotic. Unless until we send this message amongst our friends, colleagues, it cannot be solved. Just as we all know, Dr. Saini, very hardworking and passionate about this MAR and doing good work for last 4 or 5 years. But he can only initiate the things. These things can only motivate ourselves. But ultimately, we have to percolate this fire within our branches, within our wherever we practice. Unless until this chain will be break. So the intention of Indian Medical Association is to ignite our leaders so that they can percolate this message down the line to each and every physician, practicing physician, for the understanding of the AMR problem, antibiotic resistant problem, impact of this, and how to combat on this. I have no doubt in my mind the IMA has done in past also and won lot of issues, and this time also we will become victorious under the leadership of our national president. And with these words, congratulations to Dr. Saini for very well organized and pursuance. As Dr. Anil Nayak says, that the pursuance of Anil Nayak is Dr. Saini is exemplary for calling everyone. With these words, thank you very much, and I wish all the best to all the IMA leaders for the fighting against AMR. Thank you very much.
Now I request Dr. Anil Goyal, sir, former Finance Secretary, IMA headquarters, and MLA, Delhi Assembly, to read out the pledge of the AMR. I request everyone in the hall to please stand up.
Thank you, Dr. President. Thank you, Dr. Saini. Before starting the pledge, I would certainly like to congratulate and compliment Dr. Narendra Saini and the whole team and the leadership of Indian Medical Association, especially President Dr. Dr. Dilip Bhalasani, Dr. Sanjay Datta, Dr. Anil Nayak, Dr. Vinay Agarwal, Dr. Jayalal, with whom I have worked, and Dr. A.K. Ravi Kumar, who is also the hospital board chairman I am seeing, and not many more people with whom I have worked. I want to compliment them that under their leadership, Dr. Saini has taken this lead in last 3 years, and it is continuously talking about antibiotic resistance, not only among doctor circle, but also in the social circle, in the society, and giving them about hints about the hand hygiene, and to, I think, also to the political leadership. And, with that, I would speak and then
Yes,
right? Hello. So I will speak and then repeat. I am a AMR player. I realize that antimicrobial resistance is a public health priority at a global and national level for medical professionals. As a dedicated practitioner of modern medicine, I commit to sanctity of my profession by prescribing antimicrobials with integrity, care, and with each prescription. I commit to assess thoroughly,
I commit to assess thoroughly,
ensuring antimicrobials are used
ensuring antimicrobials are used
only when truly necessary.
only when truly necessary.
I commit to balance the benefits and risks,
I commit to balance the benefits and risks,
considering patient health
considering patient health
as well as public safety.
as well as public safety.
I commit to choose antimicrobials wisely,
I commit to choose antimicrobial wisely,
guided by evidence,
guided by evidence,
stewardship principles,
stewardship principles,
the specific of my patients.
and the specific needs of my patients.
I commit to defend
I commit to defend
against antimicrobial resistance,
against antimicrobial resistance,
preserving the power of antibiotics
preserving the power of antibiotics
for generations.
for future generations.
Together, let our actions contribute
Let our actions contribute
to the health
to the health
and happiness of all.
and happiness
Yes,
of
of all.
Shadow of AMR.
free from the shadow of
Long
Long live
live IMA.
We have also requested all of you, please carry a hand rub with you so that we can all do the activity. Please show the. Sir, first we have taken the hand rub. We all, please, all of us together, show the. वो दिखा दीजिए. Show that poster also. Sir, we do first rubbing this. Now we have. Now in between the first on the back of your hand, then the second back of your hand, please. Then is in between, palm to in between. Then is your tip, these fingers has to be done like this. This is the fingers. Then what is left is our thumb. So this is a thumb we have done. Now is your tip of your fingers has to be rubbed so that your nails are right. So please, all of you, please do this. We have done together. On the other hand also. And now let it dry. But if we are doing hand washing, then the clean towel is also required. So this is all we have done together. I think most of the other associations are also doing, the call has been given by Indian Medical Association to do hand washing today at 12 o'clock. So thank you so much.
And now I'll request Dr. Samram, past president IMA, to say a few words and guide us.
Hi, Dr. Dilip Banshali, past Dilip Banshali, president of IMA, and also the Narendra Saini, Dr. Narendra Saini, we dedicated person, committed person since a long time at the AMR. Anyhow, it taken a wonderful project today, and this is very really go long. And also, at the same time, we are all the doctors are committed to AMR, but the fact doctors are responsible for the antimicrobial resistance. At the same time, other than our modern medicine doctors, other misusing the incorrect use of these antibiotics. That's why we have to approach the policymakers, government, to ban the RMP's use of the antibiotics. At the same time, modern medicine doctors use the antibiotics. Then only we just achieve this AMR. Otherwise, going on this one, at the same time, use social media to educate all the people. In social media, everybody can put some videos and educate people extensively. All the IMA doctors, just to be in the social media, you tell about this AMR and how to use the antibiotic, judicious, and then only we achieve this goal. Anyhow, the IMA, what steps are taken regarding AMR, very nice, appreciable. At the same time, the leader of the AMR, the Narendra Saini, I from bottom heart appreciating his efforts.
I'd like to just tell everyone that Dr. Pankaj Johari, Director NABL, has also joined. We'll request him to say a few lines.
Yeah, sir, thank you very much. We congratulate IMA and Dr. Saini especially for this. This is a wonderful initiative. NABL and QCI is fully supported this event. We have flagged this message to all QCI employees and NABL employees and all stakeholders as well. and they are fully supporting wherever they are. So it's a full support you can ensure for NMBL.
Now I request Dr. Neelam Lekhi, the woman behind the woman power of doctors of IMA and President-elect DMA, to say a few words and her vision.
First of all, I'd like to congratulate Dr. Narendra Saini sir for taking this initiative along with IMA and taking this AMR, very important issue, AMR and hand hygiene, to such a level that it comes to the knowledge of so many people. But I request all dignitaries, all leaders, those who are here, to take it to the branch level, all state leaders and all branch leaders, to take to this initiative to each and every member. So whatever way you have the social media as well as your contacts, so you can take it to the every member, this initiative, so that it can spread to the whole country, that this is very serious issue, that antibiotics we are losing, having this resistant type of thing. So this is very good initiative. And once again, I congratulate Dr. Narendra Saini and our national leadership for taking this initiative.
Now we have Dr. Shri Kumar, Secretary of National NPPBS scheme, to say a few words. He is present with us at the national headquarters.
Thank you, sir. At the outset, let me congratulate Dr. Piyush and Dr. Narendra Saini for the excellent arrangements here, and all the leaders have been appreciating their efforts. I just would like to say two things only. One is this antimicrobial resistance, it's the way we treat them. It's from children when we treat. See, what happens is very often the child comes with fever and it doesn't subside within 24 hours. They go to another pediatrician or they change the antibiotic. I think that is one thing which we should be looking in. The second thing is we have to discuss with the pharmaceutical companies. You will see that amoxicillin syrup is 30 ml. So we write 5 ml twice daily or thrice daily. It will last for just 2 days or 3 days. So what happens is that by then the symptoms reduce and the patient stops the medicine. It's only for 3 days. Actually, it should have been for 5 days. These are very small, it goes unnoticed, but it is this time, from childhood, patients are developing resistance. I think this IMA has to take it up with the pharmaceutical companies. Thank you so much.
Now we have Dr. Shama Batra, President, IMA East Delhi branch, one of the most vibrant and the biggest branch of IMA headquarters, to say a few words.
Thanks, Dr. Piyush sir. I welcome, we congratulate our national leaders, Dr. Dilip Bhanushali sir, and Dr. Anil Nayak sir, and Dr. Shokan sir, and our past national president, Dr. Vinay Agarwal sir, and all leaders. And we congratulate this initiative is taken by Dr. Narendra Saini sir, antimicrobial resistance, and it is a very great initiative. And from so many years, we are seeing that Dr. Narendra Saini is continuously doing this work, and we congratulate Dr. Saini sir, and we all branches are with you sir, and future, whatever is the initiative regarding this, we will be there. And very great message. We should act now and protect our future and present and secure our future. That is most important. And this is a very small initiative like hand hygiene, but it has a big message. So we should learn, and all in Delhi, all schools and all hospitals are doing today. And most probably at 12 o'clock, you can see many people has put their videos.
Together, we are stronger than AMR, because resistance may be powerful, but collectively we can resolve it even in a stronger way. So coming to the closing of this program, I request Dr. Abul Hassan sir, President SBI, who has been consistently acting very positively and very aggressively for the success of this program. I request him to say a vote of thanks.
Thank you, Dr. Piyush. Good morning, all friends in Delhi and all over the country. Respected National President Dr. Dilip Bhanushali sir, Dr. Anil Kumar Nayak, President-elect, Dr. Sarbari Datta, HSG Madam, Dr. Asokan, immediate past President, and Dr. Piyush Jain, Honorable Finance Secretary, and our past presidents, Dr. Sarath Kumar Agarwal, Dr. Samram, Dr. Jayalal, Dr. Vinay Agarwal, our past SSGs, Dr. Roy, and Dr. J.S. Lele, and leaders like Utre, and young leaders like Indranil and Karan Juneja, and also our member of the Delhi Assembly, Dr. Anil Goyal. All of you, thank you all for having taken your valuable, precious time to do this, one of the very, very dutiful activity for the profession. I should say that because the AMR is doing silent sabotage in our profession, and we have done a very apt activity so that the next generation will know that we have done a very important activity. We have not just passed on this responsibility to them, and we have done such a crucial activity to contain and also eliminate AMR resistant, antimicrobial resistant. And also, we have done a most patriotic activity also, and IMA always in the forefront in addressing all the issues of all the issues in the medical profession and help government in nation building. And I am very happy to collaborate as a chairman of Hospital Board of India. And we had returned all the 34 hospitals today, and everyone would be doing some activity or other. And they might have taken photographs or video and sent it to us. And also there is another area where you will be collaborating with the AMR committee is AMR Smart Hospital, and will be aggressively promoting this activity. You know, all know that this activity is for 1 week. Already it started on 18. It will be going on 24. There are various activities. People are sending messages and reports, and we will be compiling all the reports and send it to Dr. Saini. At the end, I would like to profusely thank Dr. Saini for inviting Hospital Board of India to collaborate with them and make it a very big success. And also Dr. Piyush Jain, who is a very important anchor in the headquarters. And the headquarters, Dr. NP and HSG Madam, particularly Yogesh and team, who have done everything in a short notice and help this become a wonderful and historic activity. Thank you one and all again for your valuable time today.
Thank you, Dr. Abul, from the core of my heart for HBI becoming a great partner with us. Thank you so much.
Thank you, sir. And the Pediatric Association of Delhi, Dr. Ajay Kumar Gupta, President-elect of Delhi IAP, has also joined. And we thank him for the pediatricians joining this program. We thank the makers of Dettol, Racket Coleman, for helping us financially to organize this program in the previous, and already they are helping us in our many other projects also. So once again, thank you to the Racket Coleman. So as we come to closing of this enriching program, we let us carry forward not just the information but the inspiration. Let us walk out with renewed determination, knowing that every prescription we write holds the power to protect or to endanger the future of medicine. Choose wisely, let us lead boldly, and let us ensure that the miracle of antibiotics, one of the humanity's greatest medical blessings, remain effective for generations yet to come. Thank you all for your dedication, your passion, your promise to stand united against AMR. Together, we have a hope and we are a hope.
Okay.